Very early on in my career, I saw implants only hurt the body, both saline and silicone. And I chose purposefully to not do the surgery, do no harm. This is essentially my expertise, where I only remove both saline and silicone implants to help the many patients who are suffering from the breast implant illness. The silicone implant is a foreign body, be it saline and silicone implant itself. The body recognizes it as foreign and as a direct result forms a capsule directly around it, mounting in response. And this is what we know, where the capsule sometimes can be minimally reactive, and over time, because of the stresses on the implant, it can start basically becoming reactive, where it starts to break down and leaches more of what is that gel bleed. So the implants are certainly not lifelong devices. According to the FDA, 10 to 15 years. And from my experience, 7 to 10 years before they start becoming reactive. The FDA came up and alerted the surgeons as to the squamous cell cancer that is associated with breast implants, be it saline and silicone. The hallmark features of breast implant illness are the many rheumatological problems, connective tissue disorders that we know of. We have the inflammation that presents in the many different organ systems, and the autoimmune issues that the patient present with.
This pain was just so, and I can't even really describe it, but it just felt like somebody was taking a razor blade constantly across my left breast, to the point where I couldn't even wear a seatbelt anymore. I went to the doctors, and saying something's not right. They took me in for heart monitor, having EKGs because they thought it was my heart. Everything was normal. My left breast was sitting about 2.5 inches lower, and you could see all the veins. And at that point, I knew something was wrong.
Once the inflammatory burden is removed, that is the capsule plus the inflamed tissue in the implant, you see the many patients, well over 90% or so, that are free of these symptoms. These patients start benefiting and improving in their quality of health from when the explant surgery is done right.
Night and day since I've had the implants removed. I can now get up and live my life compared to I was in bed a lot of the time when I had implants. I had no energy to do anything. And I really owe Dr. Khan that he did the right procedure, did the right way. And I'm 2 years out since explant, and I am delighted. And at that point too, I've had a second cancer, which made me flat. And I'm okay with that, because you don't have anything if you don't have your health.
It's a privilege and an honor for me to take care of a lot of ladies, young moms, grandmothers, great-grandmothers, and the many cancer patients who come to me with their many signs and symptoms of breast implant illness. And it hurts me to see that they are very much negatively affected, their quality of life. This is a man-made problem. This is an implant-created illness, cancer. And this can be stopped and prevented. Ask your heart and your gut, do you really want to do this? When you are in your 20s, you certainly will not be like that in your 30s, 40s, 50s. And sometimes it is only good to embrace yourself as who you are, because I will not be in my 20s ever again. And as I get older, I enjoy what I have and how my body is and how God made me the way how I look. And sometimes look past what other expectations are or what other outside forces are. So you yourself provide yourself the best quality of health that you deserve.